Hi, my name is Ashley Hogue, and this is for BSN 205. And in this video, I am going to be demonstrating how to place a Foley catheter in my female patient. So as far as supplies go, I have my Foley kit. I have a clean pair of gloves, as well as a wet washcloth with soap, non-rinse soap and water that I'm going to begin cleaning my patient with. So first I'm going to knock on the door, enter the room, and wash my hands and introduce myself to my patient. Hi, Miss Jones. Good afternoon. How are you doing? Good. I verified her name and her date of birth, and then I'm going to explain the procedure to her. So Miss Jones, the doctor has ordered a Foley catheter. This is an indwelling catheter that we're going to go ahead and place. This is going to go into your urethra, and that's going to help. We'll have a drain bag collecting your urine. So before I start, do you have any questions? No. Okay. Well, I'm going to go ahead and start by just getting your perineal site cleaned up. So I'm putting clean gloves on. I've washed my hands. I'm going to have you lay in a supine position, and then I'm going to have you extend your knees outward. Okay, kind of open up this area. All right. So now that we've got you in that position, I'm going to go ahead and clean this area. I'm going to use a new side of the wash rag every time that I wipe so that I'm not contaminating. Okay, and I'm also opening up the labia here so I can make sure this whole area is cleansed. Okay, so now I'm going to place this out of our way. I'm going to remove my gloves and perform hand hygiene. All right, and then while my patient remains in this position, I'm going to open up the catheter. And the outer piece, I'm going to keep over here so that I have a spot to throw my dirty items so that I don't contaminate the sterile field. So I have that right next to me. I'm also standing on the patient's right side because I am right-handed. And thankfully we have enough space in between the patient's legs that I'm going to be able to utilize this space to place the Foley catheter and the kit, so I have enough access. So I'm going to be opening up my sterile field, just touching the corner and coming toward the patient last. Okay. So now that I have a sterile field here, I'm going to place my sterile gloves. Okay. Just touching the corners here. I'm going to actually move these over here so that I can maintain my sterile field here in the center. I'm just touching the very bottom corner, placing it on here. I'm going to use this part of my hand to get underneath the cuff so that I'm only touching sterile to sterile. Apply the glove, and then I can go ahead and fix this one too. Okay, so now that I'm sterile, I'm going to take the drapes, just touching the corners, and I'm going to hold my hands in so I'm still touching sterile to sterile. I'm going to ask my patient, can you go ahead and lift up your buttocks so I can lift up your hips there so I can get this underneath you. Okay, I've done that without touching my patient so I can maintain a sterile field. Next, I'm going to touch just the outer corners of my fenestrated drape and place this right over the perineal area where I will be using. And then I'm going to organize the items in my sterile field. So I'm going to open up my alcohol swabs which would really be iodine. I'm going to get those ready and accessible. I'm going to take my lubricant and I'm going to apply that to the catheter. I'm just going to open that up for now. I'm going to apply the syringe. I'm going to remove the lid and apply the syringe to, make sure this is staying here, where it will go to inflate the tube, and I'm going to leave that there so that once it's placed, I am ready to go. I'm going to remove the slip on the catheter, and I'm going to set it in the tray so that I can apply the lubricant. Okay, so now that I've got everything in place, I am going to clean the patient with the swabs. So I'm going to go ahead and use my non-dominant hand to open up the meatus and figure out the site that I'm going to be using. Sorry, open up the her labia so that I can view the meatus and I know which area I'm inserting. Okay, so I've opened that up here. I'm going to use the first swab to cleanse here furthest away from me on this side. Swipe once, and then I'm going to place in my container, making sure that I'm not crossing over my sterile field. I'm going to take my next swab, and I'm going to go closest to me. And then I'm also going to discard this without contaminating my sterile field. And then the third swab, I'm going directly down the middle, and I'm looking for the wink, where I'll see a little opening of the meatus that's going to help tell me where I'm going to be inserting the catheter. Okay, directly down the middle. And I'm still holding the labia open so that I can visualize as I do this. Okay, and then I'm going to warn my patient, okay, we're about to insert, so I need you to take a big, deep breath in and then exhale. Good, and as she's exhaling, I'm going to insert this into the urethra. I'm going in until I see now urine returning. So now I'm going to push it another additional about 5 centimeters or 2 inches. And I'm going to hold on to the catheter with my non-dominant hand and inflate the balloon with my dominant hand. Okay, I've inflated the balloon, and now I am going to let go here, remove the syringe, and then I'm going to gently pull back until I feel resistance from the balloon. Now it's anchored into the bladder. And now what I'm going to do is I would, collect my sample if I needed to, now that I have a fresh sample. And then I'm going to secure the bag to the patient's leg using an appropriate securement device so that we have it anchored and it's not going to risk pulling out or moving around. And then I will place the bag on the bed frame below the patient's bladder so that we have good drainage and that we're not backflowing into the patient's bladder. Once now I'm finished with that, I'm going to clean up my field, throw away all my garbage. I'm going to remove everything from the site. I will remove my sterile gloves. And then I'm going to wash my hands for the sake of the video with hand sanitizer, but real world, I would be using soap and water and washing my hands at the sink. I'll ask my patient how she's feeling, if she has any questions, and then continue to monitor. And then I'm going to document all of this into the patient's chart, as well as monitoring for the intake and output, and then management of the catheter.